Hi, and welcome to my channel, All Things BBL, where I go over everything relating to the BBL surgery. In today's video, I'm giving you my 4-week update. I can't believe it's actually been a whole month since I've had the surgery. So make sure you stay tuned, because in the end, I'm going to give a full body reveal. So here's my 4-week update. I had my surgery on May 25th, 2021 with Dr. Jonathan Fisher in Miami, Florida. So we'll start out with my measurements. Right now, my hips are measuring about 42 inches and my waist is about a 31. So my hips have gone down 2 inches. When I first came out of surgery, about 10 days post-op, my hips were 44 and now they're down to 42. So that's the most drastic difference I've seen when it comes to anything getting smaller, or my hips have gotten smaller even though they did fill them. So now let's talk faja. I've been in my faja for these past 4 weeks, 24/7, only taking it off for an hour just to take a shower in the morning. Now I'm still in my stage 1 faja that I got from the doctor's office. At 4 weeks, they tell us to go to stage 2. So I'm actually waiting for my stage 2 garment from Pretty Girl Curves. I will have to say there's actually a pro about the stage 1 from the doctor's office is the opening down below where you have to go to the bathroom. The opening goes from the front all the way to the back. So you're able to pee and do number 2 in the faja without having to take it off. And since you're stuffed with so much stuff, like stuffing the boards, it's annoying if you would have to constantly take it off to go number 2. And when I was in Miami recovering, the antibiotics gave my stomach like the worst upset stomach ever, so I had to use the bathroom a lot. So having the hole go from the front all the way to the back was a lifesaver. I never had to take my faja off to go to the bathroom. And to pee, I used the urinal, which I still use. And when you're taking a number 2 in the faja with the opening all the way in the back, if you use something called the toilet seat lifter, I'll try and insert a picture here. It actually stretches your legs so much that it stretches the opening, so it's completely sanitary, nothing is touching or anything. So that's the one positive thing about the stage 1 faja. But the only downside with the stage 1 faja is the compression. The compression isn't as tight, so I do wear foam boards, or I also wear a lipo foam 360 belt. I'll try and put some pictures in here. And in addition to wearing the foams inside the faja, outside the faja, I wear a waist cincher that cinches my waist even tighter. And I'll also show you a picture of what that looks like. So I'm definitely very stuffed feeling all day. And that's another thing, since I only take this faja off 1 hour in the morning to take a shower, that 1 hour is when I take my pictures for Instagram, when I take my pictures for my Facebook doctors group that I'm in to show them my updates, because other than that, I am squeezed away in this faja and I do not want to take it off because it's such a hassle, because there's just so many things going on. So that's the con of the faja. And another thing about the faja is I do have 2 stage 1 fajas from the doctor's office. So since I don't take my fajas off to go to the bathroom, I do wash one day and wash the other one the other day. So I'm always alternating, making sure that I do have a clean faja on, just like how I would wash my underwear to make sure I have clean underwear on. So I am staying sanitary. And another thing, like I mentioned before, when I'm taking pictures for Instagram in the morning, I'll show you some pictures that I do take, like to put on Instagram. And the only thing I actually have to touch up is I still have bruising on my butt. So that's the only thing I touch up in my Instagram pictures. I use the blur tool to take out the bruising that I still have on the sides of my butt. So when it comes to sitting, Dr. Fisher recommends sitting at 3 weeks. I'm at 4 weeks and I still haven't attempted to sit down. Now that's because, my butt is small. I did ask for a big butt, but again, my butt skin was too tight and I didn't have enough fat to actually put back there. So I don't want my butt to get any smaller. So I'm gonna try and wait to the 6-week mark to actually sit. And as for social life, these past 4 weeks, I've been living like a hermit. I haven't gone out at all unless I go to my massages, and that's, either getting driven by a friend or in an Uber. And when I'm in a car, I'm on my knees, resting or trying to lay on my stomach. So I really haven't done anything, and I'm just ready to get life started again. I'm ready to start wearing normal clothes and start having fun and going out to eat. But I did actually drive on my own for the first time. So it took about 20 days, I drove for the first time yesterday, which was a day before my month mark. But when I drove, I did use my BBL pillow to prop me up. And then as a backrest, I used the boppy pillow. And I made sure my butt was not touching the seat at all. I just made a quick trip to the supermarket, but it did feel good to be out and about, but it definitely felt a little uncomfortable driving with the BBL pillow, sitting on your thighs. I couldn't imagine doing that for a long time, but it was good to finally get out. So in this clip, I'm giving you a body reveal of how I look at 4 weeks post-op. I'll also be showing you the scars in this clip. And then I'm also gonna put some before and after pictures in this clip, but the before and afters are comparing me at 3 weeks. So, but you'll see a difference, and I'll be hopping into the video discussing the before and after pictures. So here I am, 4 weeks from my BBL surgery. The first things I noticed is my hips are not as swollen as they were the first week. I did get fat put into my hips to fill in the hip dips, but it looks like I'm back to my narrow hips, just not as bad as before. And the stomach, I'm still in my stage 1 faja, so I do have to get into my stage 2 to try and compress more. And so now we'll do the turns so you can see how everything's looking. You got the side. I do like how the stomach looks from the side, nice and flat. The butt, there's not much projection from the side. I'll go to the back, the butt. Doesn't really move yet. No movement. And then back to the front. So overall, I'm very happy with the results. I just have a lot more healing to do, trying to get the stomach more flat, and hopefully the booty will, start moving. So as for scarring goes, I do have 2 scars, one here and one here. And then on the butt, there's gonna be 2 scars, one over here, one over here. I can't pull it down. And then there's also a scar in the center of my back, which I don't know if you can see it. All the way at the top in the center of my back is a scar, but that's healing nicely. So overall, the 2 scars here, 2 scars in the butt, 1 scar in the center. So here are my before and after pictures. Now these after pictures are at 3 weeks post-op, but as you can see, the stomach was a major difference. I've gone down a lot in my stomach, and my hips, you can't really tell. I can tell my before hips were non-existent, and I had a little bit of a hip dip. And at 3 weeks, you can see where they did try and shape the hips, with the fat grafting, but it just wasn't a big difference. It's not a noticeable difference. I still look very narrow, just with a slight curve. But overall, I'm definitely very happy with the way my stomach came out. And in this clip, again, it's another before and after of my butt. As you can see, that's a huge difference. I was shaped like a square. I was, my lower butt area had no fat, and it was just very flat. So I am very excited with how this picture was also, the post-op was 3 weeks, how the shape of my butt is. The lower part of my butt has a nice cup to it, and it just has an overall nice plumpness to it. So I'm just very excited with the way my butt came out. And now they did lipo my back, but the back is I had bra rolls before, but I did notice that the bra rolls are still there, and the doctor did tell me that bra rolls are hard to get rid of, and the best thing is diet and exercise. So once I'm ready to get back in the gym, I'm gonna try and work hard to burn off those brow rolls and also try and eat healthier so they don't come back more. So the back part isn't as dramatic as the front part of my stomach. It seems like that back fat is very stubborn. Thank you so much for watching. Make sure you leave a comment below. Let me know what you thought of this video. Let me know how your recovery is going and what different things you're doing to make recovery easy. And of course, make sure you subscribe.